Therapists of Reddit, what are some interesting psychological facts about humans? Our subconscious doesn't know the difference between our heart racing out of attraction versus fear. So basically, if you're going on a first date with someone you really like, then ride some roller coasters with them, and they will find you more attractive. Something that makes me wonder how we survived as a species and then answers my question at the same time. People will adhere to what they believe to be true over what they know to be true. Politics, religion, anxiety, depression, staying with an abuser are all examples. Even when they are able to state what they know, their beliefs interfere, and that cognitive dissonance will resolve closer to their belief. As a therapist, it's my job to help them know what they know and slowly alter their beliefs to be more consistent with what they know. Too quick of a change strengthens the belief system. It amazes me every time a patient has an epiphany and then almost immediately reverts. A drug dealer's sales go through the roof if word gets out one of his customers overdosed. It's the craziest thing I know about addiction. Are you being serious? As a heart attack. I work mainly with children and families in horrible circumstances, often stemming from addiction. This is absolutely true, and it has actually led to mass overdoses, as drug dealers gain much more business once people spread the word that dealer's drug caused an overdose. People think the drug itself is potent enough for their tolerance, when in reality the drug they believe they are taking has actually been cut with something deadly such as fentanyl. I am a firm believer alcohol addiction are a symptom, not a condition. As a psychiatrist, I have never met a patient where the addiction did not either fully or mostly disappear after treating the underlying psychological psychiatric condition. Can you expand more on this, or give an example? It's interesting. I think the idea is that normal, healthy, happy people don't usually just become obsessively addicted to alcohol or drugs. Why would they if they're already doing well? The more senses you can engage in an anxiety reduction strategy, the better it will work. Your brain does not differentiate why it is ramping the nervous system up. So you have to send it the clear message that this is a safe moment to not be hyper-aroused. Can you give an example of how you would engage multiple senses at once? Note one thing that right now you can smell, 2 things you can feel, 3 things you can hear, 5 things you can see. Something like that is a really good grounding technique of rooting you back into the moment and out of your head. Motivational interviewing exists for a reason. I constantly run across comments on Reddit that say things like, "If your therapist isn't telling you to get out of this relationship now, then you need a new therapist." But humans have a tendency to dig their heels in when told to do something they feel ambivalent about. There are ways to help people realize what's going to be best for them that don't involve giving straight advice. In fact, I'd say giving straight advice can be one of the least effective methods for a lot of people issues. And these people in our office probably have a dozen friends already giving them that advice, and they're still not acting on it. I'm a clinical psychologist. Psychiatric nurse here. Redirection is a hell of a skill. For example, we had a patient screaming at us and peacocking, just ready to fight someone. He had glasses on his head and I mentioned I liked them. He said, "I need them to read books." I asked him about the books he read and we had a whole discussion about that, and he completely forgot what he was angry about. Learning about it in school, I was super skeptical, but seeing it work and using it often is incredible. Sometimes a small distraction from our feelings is all we need. I've gotten a couple to stop arguing in the middle of a theme park when I drunkenly shouted, "Oh shit, some drama!" Then I became the bad guy and they walked away together. Although there is no way to bring back the memories, playing music to dementia sufferers can bring back the feelings. The study was prompted when a dementia sufferer started crying happy tears to a song. He told the care staff that he had no idea why, but he felt really happy. His wife later identified the song as the one she walked down the aisle to on her wedding day. Your sadness has different symptoms depending on the trigger. Getting broken up with or losing a loved one often manifests as crying seeking social support. Pursuing a goal and failing at achieving it can cause reclusive behavior, feeling very tired, wanting to be alone in theory to stop you from endeavoring on another fruitless mission. There is a fairly common misconception that people in severe depressive states are the most likely to commit suicide. The data shows that suicide is most common in people coming out of a major depression who are in a manic state. Often this time period is one where the depressed individual appears to be, getting better. I want more people to know this so they can catch the red flags many people miss when a friend or family member kills themselves. This is not to suggest these are people who are relieved because they made the conscious decision to kill themselves. That is not always the case. Generally, it's people who also feel they're getting better, but very suddenly become overwhelmed and trapped by the intensity of their new heightened emotional state after spending so long in a depressive state. Sure, some people plan their suicides out, but you will find most of the time it was a very sudden and impulsive decision made by people who feel they're cornered and out of options. I have been coming out from a really bad depressive state, and since months ago everything seemed okay, and I kid you not, on Wednesday I entered in a manic state out of nowhere, and I was about to commit suicide. The weirdest this is that it was more like my body entering into a crisis and my mind was trying to get my shit together. I was so confused. Glad I didn't had anything that could harm me near, because I swear I was about to do it. It is so fucking scary. I returned to therapy on the next day. I learned that depressed people tend to have a more accurate perception of themselves than non-depressed people. Makes sense since people mostly focus on their positive attributes and ignore or don't want to confront their negative traits, whereas a depressed person's negative outlook is closer to being realistic. That said, having a positively biased view of yourself, though not too extreme, can be highly advantageous, whilst being depressed obviously has great disadvantages. Also, the mere exposure effect is a cool phenomenon. What is the mere exposure effect? The idea that repeated exposure to something leads to greater liking for it, and a less negative attitude towards it, developing a preference for things familiar to you. Songs are a good example. Often when I hear a song for the first time I'm not that amazed by it, but after listening to that same song many times I like it more and more. My frame of mind now when listening to something new is always first listen is the worst listen. I often know that while I don't. Your eyes can actually see your nose, and it would take up more of the corners of your vision had your brain not trained itself to ignore it. Basically, your brain learns to filter out information it finds not useful. Also, our memory is so vulnerable to decay that when you remember something from a while ago, you're probably just remembering the last time you thought about it instead of the actual event itself. Now I can't stop seeing my nose. An interesting psychological fact about humans is that regardless of the profession the OP asks for an answer from, a million other people with different jobs will answer. All behavior has a purpose. An extension of this, there is no such thing as people being lazy. If people aren't doing something others think they should, it's for a reason, even if said person doesn't know that reason either. It might be an avoidance tactic, a learned behavior, or even their body-mind feeling overwhelmed and requiring rest before they take on different tasks. Following that, if people are trying to rest and get nagged non-stop, they never actually get to rest and hence, never get to build up the energy to tackle the things on their to-do lists. Not a therapist, but having worked in mental health practitioners are usually just or more messed up than patients. A psychiatric nurse told me this when I did work experience. People who have had broken lives or families usually go into psychology as a way of understanding the bad crap that happened. Then many stay to help others. Not a therapist, but drug use is strongly linked to conditioning. Yes, that shit Pavlov, Watson, and Skinner did. Many addicts or drug users have a ritual. Over time, their bodies get used to this ritual, which forms an association in their brain. Due to this, in order to maintain homeostasis, their body will pre-respond to a drug. Many overdoses occur with the user taking a normal dose, just in a different setting, with different people, etc. There was a case study of 3 heroin addicts. I can't remember the other 2, but this one lady usually missed her vein 2 or 3 times before she got it in, which became her ritual. She OD'd on a dose she had taken many times before, because she got it in on the first try. People who are facing the effects of trauma can have physical symptoms that result in long-term medical issues. High blood pressure, heart-related issues, cancer, etc. Seeking treatment for trauma can help this. Laughing is a common and natural reaction for many when in the midst of a traumatic incident. It doesn't mean there's something wrong with the person or they're enjoying it. Their mind is trying to cope and release energy pent up from adrenaline. Do you know any interesting psychological facts? Leave a comment and subscribe to the channel if you want to see more videos like this one.